I want to acknowledge now a great man, a very smart person, very smart. John Sarbanes is here. It's almost as if he's been in Congress as long as his father, because he stepped in. He's done a great job, and I really appreciate you being a part of our team, Marilyn, because we do have a good team. And oh, by the way, don't forget, Nancy Pelosi was born and raised here, and don't you think we don't take that to our advantage here?
You've heard from two stellar members of the delegation. I've been just so privileged to be able to serve with Team Maryland and really to learn from these two great gentlemen in particular. I want to thank the coalition. What an incredible coalition. I know you're effective because I've signed this thing 5 times. People keep coming into my office and making me sign it.
I think they're afraid we're going to drop out.
The press is here. They can take a photograph and all the rest of it. To Valerie Henry, thank you for that very compelling statement of the case, basically, which is what you made here today for the need for universal health care. And that's what we're talking about. This is going to be the #1, it is the #1 domestic policy priority of this generation. Health care for all. And we are in we're coming to the end of a very tough political campaign right now. And we're hopeful that the result will be the one we desire. But if you thought this campaign was hard, the campaign that starts next Wednesday is going to make it pale in comparison, because you fight, you win, but then you have to govern well. And governing well in this country means we have to fix this broken healthcare system. So I want to thank the coalition for all this incredible work. We know what needs to be at the center of healthcare reform in this country. We got, as Dutch said, we got to put providers and patients at the center.
That's right.
Instead of health insurance companies, which have driven this conversation for decades now. We've got to make sure that we put an emphasis on preventive care. Too much of our system is about looking after people once they're already sick, instead of keeping them well in the first place, about healthy living in this country. And that's what this whole effort is about. Dutch mentioned S-chip. What a travesty that the president, not once, he didn't veto it once. He vetoed it twice. He vetoed S-chip twice. All we wanted to do was take the number of children covered from 6 million to 10 million. Poor children in this country. If America can't look after poor children, what can we do? And he was wrong on the merits, but you know what else he was wrong on? And we were in the chamber, so we saw this. We worked across the aisle to get that bill through. That was a compromise bill. 80% of Americans were for it. Every governor in the country was for it. A bipartisan coalition of members of Congress. We had Orrin Hatch and Nancy Pelosi at the same podium. Were for it. And he vetoed it twice on ideological grounds. He missed the opportunity to say to a Congress, when you work together to do the right thing for the American people, what they want to see, I'll reward that because I want you to do more of it. Instead he told us, don't bother. Well, we're going to have a different president coming up soon, who's one who will take common sense legislation, and that's all this is. It's just common sense. And he'll sign it, and he'll make it the law of the land. And then the last thing I'll say, and this is a nod to the labor that's part of this coalition. You've kept this issue in front of the country for all of these years. And the one thing we know, the one thing all the economists come in with their cold calculating models, is that if we get universal health care coverage in this country, the productivity of the American worker is going to go, it's already high. It's already unbelievably high in spite of all of the obstacles that are presented to the worker. If we get health care insurance in this country, universal health care coverage, the American worker is going to take us to a new level. So I want to congratulate everybody who's part of the coalition, and let's take this fight forward. Thank you.